Well, I'll tell you that within the federal health architecture, obviously we see the interoperability and the adoption of the National Health IT Strategic Plan, but those have been touched on a lot. But I will say, as far as the strategic plan goes, for us, for the Federal Health Architecture Office and for the federal partners, it's actually implementing that strategic plan in a way that is beneficial one to the other. And how do we make all of those moving pieces? Because each of the federal partners have very distinct and different missions, and therefore they have very distinct and different priorities for themselves and moving parts. So we want to make sure that we help all of the federal partners collaborate and coordinate so that we can leverage some of those moving parts for other partners as much as possible, so that we can ensure that when one of the partners is moving somewhere, that what they're expecting to be ready on the other side, whether it be policy or technology, is ready and there and waiting for them. So that's what I see as our biggest challenge right now.
Excellent point. I know in my days as CIO, we were required to have a strategic plan, and then it will always be, well, we produce a strategic plan because we have to produce one, but is it actionable, and do we actually implement it, and what are there things in there that we're actually going to do and get done? I mean, it's you want to believe that, but sometimes plans are done because we have to do one.
If I can, I'd like to give a shout out to one of our federal partners that's not here and hasn't been mentioned much today, and that's the Office of the National Coordinator, and our current National Coordinator, who has taken a stand to develop a strategic plan that is not only mandatory but is actually actionable, and has really worked hard to get all of the federal partners involved in the development of that strategic plan to ensure that it's something that we can all do and we can all work on.
Right.